Bruce Aylward headed the World Health Organization's team that visited Wuhan in February. He said when this disease finishes, hopefully, we will have a chance to thank the people of Wuhan for the role that they played in it. Of course, the disease has not still finished, but with mass vaccinations on the horizon, we are getting closer to the light at the end of the tunnel. Having said that, let me bring in Margaret Harris, spokeswoman for the World Health Organization.
Humankind has coexisted with the coronavirus throughout 2020, which is unthinkable. So what does the WHO feel about this? Do you also share the same mixture of emotions as we ordinary people do? Frustrations, heartbreaks, fears?
Indeed. We've certainly, long before this happened, we were planning, we were expecting that there would be a virus of unknown origins that jumped from animal to human and could cause severe disease. But I don't think anybody quite understood the extent of it. In many ways, some of us were well prepared, but others were not. Some of us took action early, others did not. Even so, the extent of the loss and suffering is something that none of us have experienced in our lifetime. We've not seen a pandemic that could cause 71 million cases as of today and more than 1.6 million deaths. This is a terrible, terrible loss for humanity. The good thing is we've also put our best brains together. We have worked together. We've shared data right from the beginning, shared ideas, and worked together in solidarity. So the other unprecedented thing is at the end of this horrific year of suffering, this exhausting year where people have worked non-stop to fight this thing, many of the scientists who were also working non-stop have come up with solutions. Most importantly, we now also have promising vaccine candidates, and we're beginning to see these roll out. So as my Director General says, right now we are seeing the light at the end of the tunnel, but I'd like to say it's still a long tunnel.
Yeah, but in order to accelerate our journey to the end, to the light at the end of the tunnel, what do we need to do?
We need to do more of what we have been doing. That is really finding every case, finding out where the virus is in every community, using the testing capacities that have been delivered by these brilliant scientific minds, this great solidarity, using those tests to find where the virus is, supporting people to self-isolate if they're infected, finding every contact. We've learned from a lot of good work that's been done, particularly in East Asia, that it's not just a matter of looking forward to where all the people might have come in contact, but also look back, trace your whole cluster, understand exactly where the virus is moving and shut it down. That gives us a really, a much greater strength when we start to vaccinate people, because you bring the virus down, but you increase the immunity levels in your population. So eventually you end up with pockets of virus that aren't able to move anywhere. But we have to do this by vaccinating everybody around the world at the same time. So working together and genuinely working together in solidarity and equitably, ensuring that every country, the people who need to be vaccinated, the people greatest at risk are vaccinated at the same time.
Let's say that we were able to contain the spread of the disease anytime soon. Would people really got over it without learning from it? That could be dangerous.
That's an excellent question. And indeed, it's really strengthened our belief in certain core principles. First of all, that health is a right. Now, we've always believed that, but it's important that the whole world understands it's the right of every human being. It's not a privilege. It's not something you pay for. It is a right, and we must provide the means for every human being on this planet to protect themselves from disease and get care if they do get ill. So this is why for us, and my Director General has been very clear on this from the start, that universal health coverage, and that is the access to preventive care, treatment, vaccines, rehabilitation, and a means of living a healthy life.